We're Team Ditzel. We automate pathology triage and tracking. So I'm a pathology resident at Mount Sinai, and this is a problem that I was having in real life, so I wanted to solve it. So pathology is basically the study of all of the fluids and the things that come out of your body, and we kind of analyze all the blood tests that come through the lab. So that's we'll talk a little bit about the numbers now.
So there are 150,000 surgical specimen pathology cases processed annually at Mount Sinai. It's about 200 to 300 processed daily. And these cases have very high downstream operational impact because any delays or the lack of visibility into when those cases will be completed can block patient discharges as well as new procedures.
There's a lot of things that happen before a sample that's taken out of your body comes to the lab and I see it under the microscope. So essentially, I won't bore you with all the steps, but essentially what's happening in the back end is a very manual intensive process. Part of that is we get an Excel spreadsheet every day of all the cases that are going on in the pathology department, and the only kind of a filter that we use is what's called TAT, or turnaround time. And this beautiful interface is a la Windows 95 is what I use to look at the cases that I need to do every day. And so this is my day-to-day. I log into the system, and then I get harassed by clinicians wondering when their biopsies are coming out, and then I sign it out, and then I have to call them and let them know that it's done. So the only visibility that they have that in this whole process is the end when they see the result in Epic.
So what we really need here is better tracking as well as better triage. So hospitals want to optimize their inpatient operations around discharge and scheduling, and this has immediate revenue impact. The requesting clinicians as well as patients want to have timely answers on their cases. This can avoid, for patients, not having to stay in the hospital any longer than necessary, and also timely diagnoses so that that may impact treatment outcomes. Pathologists and admins want a smarter, better way to prioritize their cases. And hospitals also want to know that the pathology cases are being completed in an optimal manner, both for clinical and financial reasons.
So now we're going to quickly go through our demo. So like Sonia said, there's two parts, which is the triage and the tracking. So the first part that you can see here is the triage. What we expect is the laboratory manager or administrative staff to primarily look at this site. What we do is we import all of the pathology cases through a CSV, and once we open that and upload it, we're able to see them down here. So what we're doing is we're providing automatic triaging for all of these cases based on a number of features. So one, they're based on urgency, but also expected turnaround time, and also other aspects such as like service. And we also provided a dashboard. This kind of shows like the daily active cases, in other words, like the backlog of cases that the pathologists have to work through. And we're able to filter that by a certain provider or by a certain service. The second part we're going to show of our product is the pathology case tracker. So this is a site that we expect both like primary care physicians and also pathologists to use. So here you can see the different cases as long as also the status of those specific cases. So whether it's in like collection or scanned, we're able to see how far along the sample has gone, and then what are the next moves. We're also given estimated completion, which is very helpful for other doctors to know when they expect a result. And lastly, I just like to show how we can filter by providers and also like services here. Now I'm going to switch back to.
So in order to build the automated and intelligent triaging for the caseload, we trained a machine learning model based on synthetic data that we generated from roughly 3 weeks of past Mount Sinai data. We used differential privacy to create the synthetic data, then trained a machine learning model using XGBoost and TabPFN on 14 different baseline features that are available when that CSV is first input, things like where the specimen comes from, other information, how many samples, things like that. And what we think is compelling about this is that it can be implemented with zero integration to PowerPath and Epic. We just use that report, which is already being generated by an administrator on a daily basis. But of course, over time, you could implement to PowerPath and to Epic and get more real-time updates, pull in more information, eventually deliver feedback back to the clinicians through Epic Chat, and maybe most importantly, over time, actually build better predictive modeling as you're trying to optimize for clinical and financial outcomes. This is our team, and that's Ditzel.